Dr. Ray Peat advice for women. Stress and special nutritional requirements. According to Hans Selye, activation or injury of tissue is the beginning of stress. The more cells involved, the greater is the stress. An injury to a leg connected only by blood vessels produces a stress reaction in the animal, so the signal of stress can be transmitted in the blood, though the nerves are normally also involved. Adenine nucleotides have been suspected as a cause of shock, because they are vasodilators, as are many other products of stress, including phosphate, but other possibilities are histamine, various polyamines, and low blood sugar. Selye divides stress into three phases: alarm, resistance, or adaptation, and exhaustion. Three tissues are usually the first to show effects. Thymolymphatic tissue shrinks, gastrointestinal tissue becomes inflamed and bleeds, and the adrenal cortex becomes enlarged. Selye classifies steroids into anti- and pro-inflammatory. Inflammation is a relatively non-specific, and hopefully local, reaction, serving to isolate the problem if it is a toxin or infection. Cortisol is a typical anti-inflammatory hormone. Deoxycorticosterone is a mounts, as a precursor of aldosterone, which helps retain sodium in stress. Sodium probably helps activate the glycolytic pathway, speeding the use of sugar. Some of Selye's stress experiments involved giving a large dose of sodium, presumably increasing the amount of DOC in the tissues, and intensifying stress symptoms. Injury and exertion have in common the need for more fuel. I think the blood sugar level is therefore useful, at least for understanding stress. Even if other substances are involved in the signaling or coordinating process. From my own experience, I am inclined to believe that blood sugar is an important integrating factor, and that the organism can probably sense small or rapid fluctuations that would be very hard to detect by the usual laboratory procedures. For example, males in particular are known to secrete adrenaline under the stress of having blood drawn, and this tends to raise the concentration of blood sugar. Even when extremely large and prolonged variations in blood sugar are found. The concept of normal range allows most physicians to dismiss them as being insignificant, even when the patient develops classical symptoms of hypoglycemia. If the patient faints or has convulsions when his blood sugar falls 50 mg/%, the physician is likely to note the psychosomatic reaction, or the coincidental epilepsy, since a normal variation in blood sugar concentration supposedly couldn't be responsible. More physicians are now recognizing that the rate of falls can be as important as the absolute level. Hans Selye sometimes used an injected metal, such as iron salts, to experimentally sensitize animals to stress, making it easier to produce arthritis. He found that vitamin E could offset this effect of iron. Stress and special nutritional requirements. According to Hans Selye, activation or injury of tissue is the beginning of stress. The more cells involved, the greater is the stress. An injury to a leg connected only by blood vessels produces a stress reaction in the animal, so the signal of stress can be transmitted in the blood, though the nerves are normally also involved. Adenine nucleotides have been suspected as a cause of shock, because they are vasodilators, as are many other products of stress, including phosphate, but other possibilities are histamine, various polyamines, and low blood sugar. Selye divides stress into three phases: alarm, resistance, or adaptation, and exhaustion. Three tissues are usually the first to show effects. Thymolymphatic tissue shrinks, gastrointestinal tissue becomes inflamed and bleeds, and the adrenal cortex becomes enlarged. Selye classifies steroids into anti- and pro-inflammatory. Inflammation is a relatively non-specific, and hopefully local, reaction, serving to isolate the problem if it is a toxin or infection. Cortisol is a typical anti-inflammatory hormone. Deoxycorticosterone is a mounts, as a precursor of aldosterone, which helps retain sodium in stress. Sodium probably helps activate the glycolytic pathway, speeding the use of sugar. Some of Selye's stress experiments involved giving a large dose of sodium, presumably increasing the amount of DOC in the tissues, and intensifying stress symptoms. Injury and exertion have in common the need for more fuel. I think the blood sugar level is therefore useful at least for understanding stress. Even if other substances are involved in the signaling or coordinating process. From my own experience, I am inclined to believe that blood sugar is an important integrating factor, and that the organism can probably sense small or rapid fluctuations that would be very hard to detect by the usual laboratory procedures. For example, males in particular are known to secrete adrenaline under the stress of having blood drawn, and this tends to raise the concentration of blood sugar. Even when extremely large and prolonged variations in blood sugar are found. The concept of normal range allows most physicians to dismiss them as being insignificant, even when the patient develops classical symptoms of hypoglycemia. If the patient faints or has convulsions when his blood sugar falls 50 mg/%, the physician is likely to note the psychosomatic reaction, or the coincidental epilepsy, since a normal variation in blood sugar concentration supposedly couldn't be responsible. More physicians are now recognizing that the rate of falls can be as important as the absolute level. Hans Selye sometimes used an injected metal, such as iron salts, to experimentally sensitize animals to stress, making it easier to produce arthritis. He found that vitamin E could offset this effect of iron. Emotional problems just before menstruation begins, and just after giving birth, the level of estrogen in the body can be high, and out of proportion to other hormones. Tension, anxiety, depression, being too easily upset emotionally, and even having hallucinations can result from this hormone imbalance. Excess estrogen causes the body to accumulate copper. And copper poisoning itself, often caused by water that is contaminated, for example by plumbing, a hot water heater, or utensils, is known to cause symptoms of schizophrenia. Menopause is another time of frequent emotional upsets, for many women. A type of psychosis sometimes occurs at menopause, since it is easier to test for excess copper than for excess estrogen. It might be worthwhile to have this test done when there are emotional problems during menopause, around menstruation, or in the first few weeks after giving birth. Tension resulting from too much copper or estrogen can be relieved nutritionally. Usually a zinc supplement is necessary. About 20 mg a day, about 30 mg of vitamin B6 has been recommended for this problem, but the amount varies with the individual. The other B vitamins, and vitamins E and A should also be used. Sometimes as much as 500 mg of niacin can be required to stop a hysterical feeling. The mildly sedative action of magnesium can also have a dramatic effect. 1/2 to 1 gram of magnesium is enough if it is taken in a highly soluble and assimilable form such as magnesium chloride. Since low blood sugar is often a factor in anxiety or depression, adequate protein and calories must be eaten regularly. Biotin, 1 to 2 mg, can stop some depressions. Fruit is very useful in maintaining blood sugar since it provides sugar with potassium, which helps to avoid an insulin reaction. People diagnosed as psychotic women are increasingly being diagnosed as manic depressive, though this used to be thought of as mainly a man's disease. I think the new popularity of lithium therapy has contributed to this diagnostic trend. Even if the problem is what had previously been described as premenstrual depression, lithium therapy does work, though some PA patients complain of tremor, dullness, and clumsiness. Several of the known biochemical effects of lithium are similar to those of progesterone, including antagonism to aldosterone, modification of serotonin metabolism, elevation of nerve thresholds, and facilitated disposition of ammonia. Other psychoactive chemicals which have some overlap with progesterone are dopa, bromocriptine, and phosostigmine. One type of schizophrenia, and the very common symptom of agoraphobia, or reclusiveness, are associated with high levels of porphyrins and pyrols. Fasting, liver damage, and increased estrogen levels can raise the concentrations of certain of these substances. They seem to promote urinary loss of zinc and vitamin B6. Estrogen promotes copper, and iron, and calcium retention, and copper tends to displace zinc. The high levels of copper, iron, and lead which are found in many people with mental problems may be secondary to a hormone disturbance. Thyroid gland or progesterone, or both, can produce a complete disappearance of mental symptoms when those symptoms result from any biochemical imbalance that can be rectified hormonally. Because these two substances have very generalized regulatory functions, I feel that any diagnosis, naming in Latin, of a functional mental disturbance, is at best irrelevant, and may be very destructive. People with diagnoses of schizophrenia, epilepsy, manic depressive psychosis, Parkinsonism, myasthenia gravis, involutional psychosis, neuritis, sclerosis, etc., have reported that they felt normal or improved after taking progesterone, often within 40 minutes. Magnesium, as Epsom salts magnesium chloride or carbonate, can relieve some cases of irritability and tension, even when something else, such as hypothyroidism, is the basic cause. Many symptoms have been blamed on cerebral edema, which might result from too much estrogen. However, the speed with which some symptoms disappear suggests other possible explanations. Just as veins in the forehead shrink immediately if a large amount of sugar is taken for a migraine, I have seen veins, back of the hand, disappear with progesterone treatment, just when a suicidal depression is lifting. This suggests that there may be a migraine condition in the blood vessels of the limbic system of the brain. But there are also very rapid shifts in brain chemistry. Light and smell are known to affect hormone production. A musky material, lamagnans, exaltolide, probably includes androstenol, is probably a social regulator of hormones. Perfume containing musk might affect the woman who wears it. Bright lights for 18 hours per day can correct some hormone mood problems. Canker sores, herpes infections, and bleeding gums, if associated with mental symptoms, suggest a thyroid and/or progesterone deficiency. Arthritis and stress. Dr. E. C. Barton Wright and Dr. W. A. Elliott have found pantothenic acid, at least 25 to 50 mg per day, useful in arthritis. Arthritis is commonly a result of stress. Stress increases the need for that vitamin and also for other nutrients including vitamins A and C. Arthritis often follows surgery. Sometimes surgery can bring on chronic allergic problems, hay fever, gas, fatigue, etc. But it can also apparently weaken the immune system so badly that old allergies disappear after an operation. Stress inhibits the thyroid, and can lower progesterone, and/or testosterone, while raising estrogen. Recent work by C. Terry and his group shows a hormonal involvement in various autoimmune diseases. Females are much more susceptible to these sicknesses than are males. Systemic lupus erythematosus and rheumatoid arthritis are common. Vitamin A offsets a protein deficiency, and a protein deficiency can damage immunity. Any activity, if planned and completed according to plan without interruption, can reduce stress. Enforced inactivity, and inability to achieve what was intended, are powerful stressor. The adrenal hormones and mineral metabolism are disturbed in stress, whether the cause is a disorganized style of life, or the injury of surgery. The diet should include about 90 grams of protein, in frequent feedings, eggs as a source of sulfur, needed to synthesize joint lubricants, for example, and should keep the ratio of magnesium to calcium high, as with vegetables, bran, fruit, and the phosphate intake low. This would include using green leaves in place of some meat, as well as using cheese. Vitamins C, E, and pantothenic acid are needed in especially large amount in stress. Vitamins A and B2 are also essential for production of the anti-stress hormones. Inositol is known to protect biological materials from many kinds of damage, and might have this effect in arthritis, but I don't know of any research in this particular application. Iron salts and other heavy metals have been shown by Hans Selye to produce arthritis, possibly by their ability to destroy vitamins E and C. Copper is a specific oxidant for vitamin C. It is associated with many inflammatory diseases, and should probably be better investigated in degenerative diseases, including arthritis and glaucoma. Pantothenic acid in very large doses was recently found to protect against stress even when an animal's adrenals were removed, since the nutrient is needed to destroy insulin. I think part of its anti-stress effect comes from minimizing hypoglycemia, and so reducing the amount of cortisone needed. On the cellular level, stress lowers the energy charge. Systemically, stress inhibits oxidative metabolism. Both of these observations indicate that the basic anti-stress hormone would be thyroid. Hypothyroidism often involves arthritis. Sometimes the tiny bones of the ear which transmit sound are affected. Ringing of the ears and deafness for high sounds are common in hypothyroidism. M. Kirchgassner and H. L. Mueller. The effect of varying the protein diet on the trace elements content of early weaned piglets. Landwirch-Forsch asserts, copper, dry body matter clearly fell when the protein supply was increased. Blood pressure, vitamin E and other nutrients. The kidneys produce a material that raises blood pressure sure. And the production of this chemical is increased when the supply of oxygen is not adequate. Other tissues probably produce similar chemicals. Normally, as soon as the blood pressure is increased, circulation is improved so that an adequate amount of oxygen is delivered to the tissues. However, there are many processes that can waste oxygen, and some of these tend to increase gradually with age, so that the blood pressure rises steadily over the years. General tissue damage, malnutrition, and hormone imbalance can all produce conditions in which oxygen is consumed without producing a normal amount of energy. Also, a failure of the small blood vessels to open properly can cause oxygen deprivation, as can a tendency to form small clots. All kinds of stress tend to make the liver sluggish. The liver normally removes toxins and excess hormones from the body. Estrogen can accumulate to high levels if the liver isn't fully active. One effect of estrogen is to promote oxidation of a type which doesn't provide energy, thus raising oxygen requirements. Another effect of estrogen is to inhibit a proteolytic enzyme in the blood, which normally dissolves clots. This is why birth control pills can cause blood clotting, strokes and other circulatory problems. Some of the long-recognized signs of excessive estrogen are vascular spiders, little red dots that some doctors like to burn off, brown spots on the skin, lumps in the breasts, a slight bluish color in some skin areas, puffiness, dizziness, etc. Vitamin E promotes oxidation in many ways, and seems to specifically oppose many of the effects of excess estrogen. For example, it can help protect the liver against damage by toxins. All the nutrients are needed by the liver though. It opposes the tendency of estrogen to create age pigment. It activates the blood protease, and so speeds clot removal and prevents clot formation inside blood vessels, but there is also evidence that it promotes normal clotting in wounds. The products of dissolving the proteins of clots are small peptide molecules called kinins, which act as local hormones to relax the walls of blood vessels, allowing easier flow of blood, better oxygenation, and lower blood pressure inside the cells. Vitamin E inhibits destructive and wasteful oxidation, such as is involved in aging and cancer, and makes the normal oxidative process more efficient, providing more useful energy for a given amount of oxygen. One theory of vitamin E action is that it protects progesterone. A recent discovery is that a prostaglandin, a hormone made from fatty acids, regulates blood pressure via the kidney. Vitamin E protects fatty acids. Recently it has been found that some natural vitamin E is contaminated with estrogen from the plant source, e.g., alfalfa. Part of the reason for the common medical disbelief in the efficacy of vitamin E is that it doesn't work like a drug. A big dose doesn't immediately force the blood pressure down. Sometimes, in fact, the first effect is to strengthen a damaged heart, raising the blood pressure for a few days. But it does eventually remove many of the causes of high blood pressure. And I have never seen it fail to lower high blood pressure. Synthetic vitamin E is D-L-alpha tocopherol, and may be associated with the reports of fatigue and headache from 800 units a day. However, this often repeated rumor is hard to track down, sort of like stories of blindness from vitamin A or LSD. Some natural vitamin E brands are contaminated with the petroleum distillate used for extraction, and taste like kerosene. The name D-alpha tocopherol indicates that it has been extracted from natural oils and has the handedness, chirality, of most biological substances. D and L mean right and left. Other vitamins that can improve circulation by opening the small blood vessels are folic acid and niacin. Vitamin C can help to eliminate toxins that could contribute to high blood pressure. Trace minerals, such as those found in kelp and bran, and magnesium should also be considered in circulatory problems. Magnesium acts against calcium and estrogen in the clotting system, can prevent spasms of blood vessels, and can spare oxygen. According to Barnes, nearly all hypertension can be helped with thyroid. Pregnancy and children age and pregnancy women are often encouraged to have their children while they are young, by the fear of having a mongoloid baby, Down syndrome, which happens more often in older mothers. But someone did a study that showed that mongoloids are born more often by women who have been married longer. Women who marry at 30 or 35, for example, were found to have fewer mongoloid babies than women of the same age who had married younger. The investigator suggested that long married couples so seldom made love that the chances were greater for the egg, or egg and sperm both, to deteriorate before being fertilized. Other studies show teenage mothers have babies with smaller brains than average, and with a greater chance of being slightly retarded. Smoking during pregnancy has the same effect. Carbon monoxide in city air would probably contribute to the damage. If women are encouraged to have babies younger, will the population have smaller brains? Diabetic women are known to typically have large babies with big heads, who learn quickly. With each pregnancy, a woman tends to have less glucose tolerance, or to seem more diabetic. HCG, the hormone which helps sustain pregnancy, raises the blood sugar to meet the fetus's need for abundant sugar. So diabetes and pregnancy have much in common. And as a woman gets older, she tends towards diabetes, and so tends to nourish the fetus better, especially its brain. Besides this natural tendency, a more mature woman is less likely to live on snack foods. The results of these studies indicate that later marriage would help to reduce the number of mentally retarded children. And better nutrition before and during pregnancy and nursing makes a great difference in the baby's mental and physical development. Young women who are pregnant should be especially careful to avoid low blood sugar. Older women will probably require a little more vitamin E, and should be especially sure that they aren't getting a toxic amount of copper from their water supply or utensils. Regardless of age, pregnant women should make a special effort to get perfect nutrition every day, and to avoid poisons, including drugs, fumes and smoke. Even drugs which don't enter the fetus directly can affect its health by disturbing the mother's metabolism. Many drugs, and food additives, can increase a person's nutritional needs. For example, by increasing the rate at which vitamin C is lost in the urine. Recently there has been a great increase in sterility from endometriosis. Delayed reproduction is a suspected factor. A progesterone deficiency has been implicated. Thyroid, protein and vitamin A help to maintain progesterone production. Alcohol and other drugs used by the father can also cause birth defects.